Hello students, myself Mr. Santosh Pawar welcomes you all in the MGC learning. In our last lecture, under the chapter Control and Coordination, we had seen one endocrine gland such as the adrenal gland. We had seen its position, its color, its origin, and we had also seen the structure of adrenal cortex. Today, we are going to see the disorders related to the adrenal cortex. There are two disorders related to the adrenal cortex. One, it is called as Addison Diseases, and number two is a Cushing Diseases. So student, there are two disorders related to the adrenal cortex. One is Addison Diseases and number two Cushing Diseases. Student, we will also see the structure of adrenal medulla, its a hormone and their function. So student, let's start with our first disorder related to the adrenal cortex. Number one, that is Addison Diseases. It is caused due to hyposecretion of a corticoid hormone. Means if the corticoid hormone is secreted in a very less amount, it causes a disorder. That disorder is called as a Addison Diseases. The symptoms of Addison Diseases are as follows. They have a low blood sugar. Number two, they are facing the problem of a low blood pressure. Student, I repeat the symptoms or the characteristic feature of Addison Diseases. Number one, they have a low blood sugar. Number two, they are facing the problem of a low blood pressure. Number third, student, the major symptom of Addison Diseases is bronze-like skin coloration. Bronze-like skin coloration is a major symptom of Addison Diseases. Point number 4, there is a decrease in a sodium ion concentration in plasma, but there is an increase in a potassium ion concentration in plasma. Student, this condition is also called as a blood acidosis. So blood acidosis is one of the major symptom of Addison Diseases person. They have a decrease in a sodium ion concentration into their plasma. So the sodium ion concentration into the plasma in a decreasing level, but concentration of a potassium ion in a plasma is in a increasing level. That means decrease in a sodium ion concentration in a plasma, but increase in a potassium ion concentration in plasma. This condition, it is called as a blood acidosis. The fifth symptom is there is an increased loss of sodium ion and the water from the urine. There is an increased loss of sodium ion and the water in the urine. That means this is a problem of dehydration. So Addison Diseases, they also have a problem of dehydration because there is an increased loss of sodium ion and water in urine. The other symptoms are there is a weight loss, weakness, nausea, vomiting and diarrhea. So other characteristic or the symptoms of Addison Diseases are there is a weight loss, weakness, nausea, vomiting and diarrhea. So this is about the first disorder related to the adrenal cortex. It's nothing but the Addison Diseases. I repeat the points once again. It is caused due to hyposecretion of a corticoid hormone. Its symptoms are as follows. They have a low blood sugar. Number two, they are facing low blood pressure problem. Number third, major symptom is bronze-like skin coloration. Number 4, decrease in a sodium ion concentration in a plasma, but increase in a potassium ion concentration in plasma. This condition is called as a blood acidosis. Fifth symptom, increased loss of a sodium ion and water in a urine. This is called as a dehydration. So Addison Diseases, they have a problem of dehydration. Other symptoms are number 6, weight loss, number 7, weakness, number 8, nausea, number 9, vomiting, and number 10, diarrhea. So this is about the Addison Diseases. Let's start with the second disorder, which is called as a Cushing's Diseases. It is caused due to hypersecretion of a corticoid hormone. So if the corticoid hormone is secreted in an excess amount, it causes a disorder which is called as a Cushing's diseases. So it is caused due to hypersecretion of a corticoid hormone. The characteristic feature or the symptoms of a Cushing diseases. The first symptom, it is of a high blood sugar. They have a high blood sugar. Number two, they are facing the problem of a high blood pressure. So high blood sugar and the high blood pressure are the major two symptoms of the Cushing diseases person. Number third, one of the major symptom is there is a muscle paralysis into that patient. There is a muscle paralysis into the patient. Fourth one, there is an increase in a sodium ion concentration in the blood. Student, in Addison diseases, there is a decrease in a sodium ion concentration, but in a Cushing diseases, there is an increase in a sodium ion concentration in blood. So this condition is called as a blood alkalosis. It is called as a blood alkalosis. Further, there is a excretion of a glucose in a urine. So glucose is excreted out from the urine. And the last symptom, it is of obesity. So obesity is also one of the characteristics or the symptoms of Cushing diseases. I repeat all the points of Cushing diseases once again. It is caused due to hypersecretion of corticoid hormone. So hypersecretion of a corticoid hormone causes a disorder called as a Cushing diseases. The symptoms, high blood sugar, high blood pressure. Major symptom is muscle paralysis in a patients. Number 4, increase in a sodium ion concentration in a blood, which is called as a blood alkalosis. And number 5, excretion of a glucose in a urine. And number 6, that is obesity. These are the symptoms or the characteristic features of the Cushing diseases. Student, now we start with the adrenal medulla. Adrenal medulla. As you know that adrenal gland consists of two regions. Outer region is called as a cortex, inner region is called as a medulla. So medulla is the inner region of a adrenal gland. I repeat, medulla is the inner region of a adrenal gland. It develops from the ectoderm. That means it is ectodermal in origin. It is ectodermal in origin. It secretes two hormones. One, it is called as adrenaline, and second one is called as a noradrenaline. So there are the two hormones which are secreted by the adrenal medulla. One, adrenaline, which is also called as a epinephrine. Student, another name for the adrenaline is epinephrine, and the another one is called as a noradrenaline, which is also called as a norepinephrine. So epinephrine, it's nothing but adrenaline, and the norepinephrine, it's nothing but the noradrenaline. Let's see the function. The function of adrenaline. Adrenaline prepares the body to face emergency condition. It prepares the body to face emergency condition like fall in a blood pressure, muscular exertion, pain, cold, injury, anger, fear. So it is also called as a emergency hormone or 3F hormone, that is fight, flight and a fright hormone. So it is also called as a emergency hormone or 3F hormone, that is fight, flight and a fright hormone. I repeat, the function of adrenaline. Adrenaline prepares the body to face emergency conditions. It prepares the body to face emergency conditions like fall in a blood pressure, muscular exertion, pain, cold, injury, anger, fear. So adrenaline or the epinephrine is also called as an emergency hormone or 3F hormone, that is fight, flight and a fright hormone. Noradrenaline hormone. The function of a noradrenaline hormone, it regulates the blood pressure. So it acts as a vasoconstrictor. Student, I repeat, the function of a noradrenaline, it regulates the blood pressure. So it acts as a vasoconstrictor. It acts as a vasoconstrictor. So students, we have seen the disorders related to the adrenal cortex, that is Addison diseases and the Cushing diseases. You can take a difference between the Addison diseases and the Cushing diseases. Addison diseases is caused due to hyposecretion of a corticoid hormone, whereas Cushing diseases is caused due to hypersecretion of a corticoid hormone. There is a low blood sugar problem in a Addison diseases person. There is a high blood sugar problem in a Cushing diseases patients. There is a low blood pressure in a Addison diseases person. There is a high blood pressure in a Cushing diseases person. The major symptom of Addison diseases person is a bronze-like skin coloration, whereas the major symptom of a Cushing diseases person is a muscle paralysis. Addison diseases shows the blood acidosis, whereas Cushing diseases shows blood alkalosis. Also shows here the blood alkalosis. Students, we also see the adrenal medulla, which is the ectodermal origin, and it secretes two hormones. One is adrenaline and other is non-adrenaline. Adrenaline and the noradrenaline. Adrenaline is also called as a emergency or 3F hormone. Emergency or a 3F hormone, that is fight, flight and a fright hormone. Whereas noradrenaline acts as a vasoconstrictor because it regulates the blood pressure. So this is about the end of our adrenal gland. Thank you so much.